Hello, everyone. My name is Mark Kageyama, and I'd like to welcome everyone here to Be Your Own Hero. I'm a stage 4 prostate, bone, and lung cancer patient, doing really well, and I'm just so happy to be alive every day. Open my eyes because every single day is just such an incredible blessing. And, you know, as cancer patients, I think we all really appreciate, the meaning of life and how important life is to us. And so I'm what we're doing here is we're doing part 3 with Kezhal Dashti, and she's gonna finish telling us, the majority of her story, and we talked about her going through college and everything like that. So I'd like to bring Kajal on and to reintroduce herself, and we could get going on what we're going to speak about today. So, welcome again, and thank you again, Kajal. Please introduce yourself.
Oh, thank you for having me. I'm Kezhal Dashti. I'm a 9+ year ovarian cancer survivor. I was diagnosed at 21 years old, and now it's been 9 years later, and I still do a lot of work, obviously, to help raise awareness for ovarian cancer and other cancers. But since then, I became a news anchor. I started my own business with my husband, and now I'm running that business with him. It's been running successfully for 3 years, so it's a lot's changed since 9 years ago, but it's all been for the better.
I just absolutely love that. You're living life, and you're not feeling sorry for yourself. I mean, you got cancer at such a young age, and to navigate that whole thing, I mean, I really admire that. I think it's incredible. And the thing that I've noticed about particularly younger people who get cancer is just this incredible maturity that you all have. And I mean, you're light years ahead of me at your age. I mean, I was just like trying to figure things out, and I just love the way you're moving forward, and you're also advocating for cancer. So yeah, why don't we start there? What are your thoughts on that?
Well, I think I completely agree with what you're saying. I feel like it's trauma in a way, because cancer again is a trauma, and chemotherapy is a really traumatic event you're going through, and it forces you to grow up. Like, you don't, suddenly reality hits. You're like, okay, I could potentially die. There's a good chance I'm not going to make it. And then, I had my ups and downs. I was not the star patient. I have met people who definitely handled chemotherapy better than I did at my age. But I, it's all about, I guess, how I look back, and obviously again, I wish I could change how I handled it, because now I look and I'm like, it's all about your mindset in a lot of ways, and how you deal with things. And for me, when I finish, and I think this goes for a lot of cancer patients, afterwards, you do, for a lot of us, we feel very confident, and like, this is it. This is, every day is precious. So what am I going to do with it? And for me, that was going after my dreams and making those happen. Because for a long time, it was just talking about it. And I am the kind of person to take action. And I was very involved in school and work, but it really, like, it lit a fire, and it hasn't stopped. So
That is awesome. So were you like that prior to cancer, as far as, not procrastinating and doing things, uh, right
like right
away?
away.
Yeah.
Honestly, no. I was like the person who procrastinated. I talked a lot about just doing things, or the thing that I probably did the best in college, even before I got diagnosed, was work. Like, once I started interning, because I wasn't allowed to just work at like a restaurant or anywhere growing up. My parents were very much the, no, I'm not taking care of you to go work at a restaurant. I'm taking care of you to study so you could go to college, and that's all they could think about. So once I even got to college, it was internships and what can I do that'll help me progress in my profession. So I did a lot. I did really have like a go-getter mentality. I was really confident even in like interviews and with work, but I still was very reserved on a lot of things that I wanted to personally do. Like, I mean, this week, for example, or this last few months, my husband and I were like, I've been talking to my husband about wanting to be represented by an agent and maybe one day going into acting. And then honestly, this year I was like, why am I waiting? It's free to get an agent. I just got to see if they're interested. And now I've been signed by an agency here that's a really big one and a really well-known one. And I'm excited about it. And I'm like, you know what? It's all about just doing it. So I
Congratulations, by the way.
thank you. I know I'm really excited, but it's like I didn't have that. I kind of just put some of those dreams, I guess, quote unquote, off because I was like, you know what, it's just got to focus on work and this. But after, all was said and done with chemo and having cancer, it really was like, I don't want to waste my time doing things that don't make me happy. It's why I left TV news so quickly. I really quickly realized this is not the environment I want to be in. This is not the kind of job I want to do. I don't want to wake up in the middle of the night to go to work. This isn't what I envisioned on camera work, I guess, is what I had dreamed of doing, of being like. So I pivoted and I instead found a way to make it work in a way that made me happy. Because again, every day is really precious. I don't want to spend it doing something that makes me miserable or makes me unhappy. I did that for 2 or 3 months and that was chemo and that's it. I'm not doing that again. So I guess that's kind of like my mentality since. It's just, if I have an idea of something I want to do, I'll try it. If it doesn't work out, it doesn't work. But at least in my mind, I can always say I gave it a shot.
That is just beautiful, absolutely beautiful. And you're whatever you do, I know you're going to do it successfully, and
Thank
it'll
you.
work out well. Because if it doesn't at first work out well, I know that you have the perseverance to make it work, and
Thank
that is so important. So that is fantastic. So you developed essentially a new you through your cancer journey.
Yes, I did.
Okay. And so coming out of college and everything, let's talk about that and move the timeline forward.
Yeah. So yeah, once I finished college, I really quickly moved from the Dallas-Fort Worth area to El Paso for work. And it being the first time I've ever left home. I grew up in a very Middle Eastern household. My parents did not even let me live in college. My college was only 15 minutes away from home and they didn't let me live on campus. So I was very much attached to my parents even because of how much I had been around them. So moving to another city, and Texas is a big state, complete opposite side of Texas was very traumatic in a sense, but I was excited because it was like a job I wanted to do. So in order to like get more involved in the community, especially because I was one of the on-camera talent, they did like for us to be involved in the community. And for me, it was a no-brainer to do something related to cancer. And for me, what was funny is ovarian cancer was not the first one I went to. It was the Make-A-Wish Foundation because I was so upset, I guess, at how young I was. And I was 21. I wasn't even young enough, I think, for Make-A-Wish standards, really. But I just looked at young adult and childhood cancer very differently. I was like, wow, cancer was always something I thought you got, when you were a lot older. I really never expected being so young to get diagnosed. So that's why I think I felt so drawn to working with the Make-A-Wish Foundation. And I ended up being a wish grantor for about a year and a half. And I stopped really because it started to affect my mental health really negatively. Not that it was that they did something wrong, it was just very heavy. I didn't get any therapy done really after I finished chemo. And I think that's something a lot of survivors should consider when finishing treatment because your life really isn't back to normal. I mean, things are still very different. You're still trying to feel like, it normal again. And then I think I thrust myself back into, the cancer world really quickly. And the first kid that I helped through the wish granting process passed away. I think it was like 8 months later. It wasn't even, I think, a year later, and it really affected me. So I took a lengthy break from probably like a year and a half, 2 years of a break. I still help, like there was another ovarian cancer nonprofit in El Paso called Diana's I Will Live Foundation. And I helped them from time to time, like speaking at events or attending like a 5K, or they one time flew me out to Austin to speak to a bunch of young women, young professionals, telling them my story so that they learn like the importance of early detection and why young people should be paying attention to their bodies. So I really quickly did get involved in, giving back to the cancer world, because again, as I said, mentioned before, the thing I really wanted to do, like towards the end of my treatment, that I promised myself, was doing something with my platform or helping make a difference in someone else, because I felt very lonely through chemo. I felt it was a very sad thing. I didn't, I, it, it was a very dark moment for me. And I didn't want it to be that. I wanted to look at it differently. I wanted to think how blessed I was in my situation, that my cancer was, so, as my doctors kept saying, was chemosensitive. So it was really, it was 2.5 months of a lot of chemo, but my chances of recurrence are less than 1%. So my chances are really great. And I know a lot of people don't have that. And I, it pains me that that is the case, but I really wanted to help and give back and help those who were not as fortunate as me, like the people I know that have now passed since that I have met. But yeah, getting involved was a no-brainer. It's been difficult sometimes, but again, it's just a no-brainer.
Sometimes I talk to, new people all the time, almost essentially every day, in fact, several times a day sometimes. I mean, it just depends on the day. And I always feel like I've been blessed with a secret that I want to share. How do you feel about what you've gone through?
I mean, I know what I've gone through is really, difficult and sad. And when I think about the story, when I even tell the story, sometimes I get choked up because it really was a hard time. But I always I do look back and I
Why
think,
was it sad?
it I mean, when I look at it, I'm like, we were really lonely. Like it was just me and my parents inside one small room, getting waiting while I was getting infused for 8 hours. So it was very lonely. It was just, a time I wasn't allowed to even have a lot of family members over, because if they had small kids who were going to school, it was a risk of getting me infected. So I couldn't have a lot of family around. And I could tell that bothered some family members a little bit, because, they wanted to help, but at the same time, we couldn't have them just come around. So it was a very isolating time. At the same time, I had a grandmother who has since passed from pancreatic cancer, but she was paralyzed from the waist down. And she was on her own every day at home. I always choke up thinking about her, because she couldn't even go to the bathroom on her own and stuff, and waited all day sometimes just because of my 8-hour treatments. So, I look back and it was really a difficult time. I wouldn't want that on for anybody. I mean, I know a lot of people do have a big support system, and I still did have a big support system. I'm not saying I didn't. I told you, I have my best friend who came by and was really there for me to help me with my mental health. But really, when you look at cancer, it's a really sad thing. My father won't admit this, but I know his business went downhill because of him missing work, essentially, to come sit in a small room that had terrible cell reception or any Wi-Fi reception. Honestly, it was hard to even get me to watch like a streaming show without there being some lag. He couldn't work. I mean, it was just, I look at all the sacrifices we had to do, all the money we had to spend. And those are the things that really don't get talked about a lot with cancer. Um, so that's why that's why I really do feel so moved to be involved, because I don't want anyone else to go through that loneliness or go through that pain, or because everyone around you in some way has to deal with it as well, and they're going through something. I know my mom was affected in some way. I know my dad was affected in some way. I know my sister and my grandmother were affected. So it's just, I don't look at, it was a really dark thing, a dark moment in my life, and I want to do what I can to not see it that way as much anymore, by giving back in ways I can. I'm not a wealthy person, so I can't donate large sums of cash, but if I could donate my time and donate I mean, even my telling people my story, if that could get a young person paying attention to then prevent them from having to go through what I went through, I'll do it. I'll do it as many times as I have to.
But you are giving of yourself and of your heart, which is even more important, I think.
Thank you. Sorry, my answers are really long-winded, and I know that.
No, but it really reflects on your journey and what you actually went through, because as time goes on, we tend to forget certain things, and all of a sudden we get reminders and say, oh yeah, that happened, and I remember that, because I think as human beings we want to forget the bad things as much as we can so that we could move on. But those bad things are what we learn from, and,
I
and
agree.
you're using it to your advantage to
Mhm.
advocate
Mhm.
for other people, and that
Yes.
and that is a beautiful thing. That is
Thank you.
that is really, really great. So you worked at Make-A-Wish Foundation. What else are you doing?
So, I mean, since then, since I've even moved back to the Dallas-Fort Worth area, I've been getting involved with the Be the Difference Foundation, and they're a local nonprofit that raises awareness, research, and money for clinical trials, even for ovarian cancer. So, it was founded by 4 ovarian cancer survivors. One unfortunately did pass, I think about 10 years ago. And these women started something really so incredible. They have an event every year called Wheel to Survive, and it's been going on, I think, I want to say since close to when they formed Be the Difference. And it's called Wheel to Survive. And every year they have this big cycling event where you're basically cycling to raise money for ovarian cancer research, and just the money goes back to the survivors and to those who are potentially going through treatment. So I love everything that Be the Difference stood for, and I knew it was like a no-brainer getting involved. And they also have like a fashion show every year that they started the year that I actually came back to Dallas Fort Worth in 2019. It's called Runway for Hope. And I was one of 14 or 15 models their first year. We were all ovarian cancer survivors. They made us feel super special. I mean, they dressed us up in clothing from Nordstrom's, hair and makeup done. We got to walk a runway. I mean, it was where I felt like a princess. It was amazing. And this year I got to MC the event, and which was really cool, being on the other side watching the models and not being one model this year. It was really cool. And since then I've joined the board of the Be the Difference Foundation now. So, and hopefully we can bring, a younger perspective, because I was only 21 when I was diagnosed with ovarian cancer, and I know a girl who went to my college who passed only a few years ago. I want to say actually 2 or 3 years ago from ovarian cancer. So, yeah, it was obviously a no-brainer to be a part of Be the Difference. And I'm also, as of today, on the board of the Mary Crowley Cancer Foundation, which they are raising awareness and funds for Mary Crowley Cancer Research, which they host a bunch of clinical trials. They have already 18 FDA approved drugs that are out there to help cancer patients. So, I mean, at the end of the day, I'm here because of the drugs that these doctors have come up with and done all this research behind. So, and Mary Crowley is also who we, at Be the Difference for Runway for Hope, raise money for. So when we're at the fashion show, we're raising money to have a clinical trial specifically for ovarian cancer. So, and we did that this year as Runway for Hope. So they have hopefully a clinical trial that they're going to start soon for ovarian cancer. So I'm just so happy to be a part of these organizations. I'm meeting so many survivors, and it's really cool meeting especially other ovarian cancer survivors. We have like a lot in common, which is crazy. And of course, Mary Crowley in a lot of ways was a no-brainer, because I mean, only a year and a half after I finished chemo, my grandmother died of pancreatic cancer. And I always wonder, pancreatic cancer is almost, it almost feels like a death sentence. And it was for her. She passed within 4 months of being diagnosed. And I always wonder if there was something, a drug like what I was getting for my cancer, she would be here and she would have seen me get married. She would have seen me become a news anchor. And that's, she was like a second mom to me. So she lived with me my whole life. Um, so I think about her a lot when I volunteer and when I, do a lot of these things, because she should be here right now. My grandfather is still here too, so it's like I want my grandmother here to see all that I've accomplished. And I always say that she's watching me, and a lot of my successes must be her. She must be pushing me the right way. So um, I want to do it for her and for a lot of the people that I had met along the way who passed. So again, it's um, it can sometimes be mentally taxing, obviously surrounding myself a lot around with cancer, but it's just a no-brainer. I want to do what I can to help make a difference in the community, some real change.
I love that. I love that. Thank you. Thank you for doing that. Thank you for making this incredible effort that you do. And the more people we get like yourself and other people that we know that keep pushing. I'm beginning to kind of see, more, it's getting out there more, and there's more people involved, and the community is
Yes.
really, really phenomenal with
Mhm.
incredible people. And so,
It's true.
I have a question. I'm going to go back to you, but I'm going to ask you this question first. So please share about Cancer Go and your
Yes.
affiliation and how all that happened.
I was gonna just say I wanted to talk to you about Cancer Go. I'm the spokesperson for Cancer Go. Cancer Go really it's a startup that was to intent. At first, we were wanting to make it a social network, but really, what Cancer Go is, it's more than just a social network. It is a hub for those who are going through cancer and those who have been impacted by cancer. It's like a one-stop shop. We want it to be a place where you can not only connect with other survivors, patients, and where your family can get on and connect with others, but we want it to be it's a place where you can contact a nurse navigator and ask questions. You can talk to a therapist. You can talk to an oncologist if you have a question. If you have questions about your chemo or you need resources for finding a nurse navigator, Cancer Go is supposed to be that one-stop shop, and it really is becoming that. We're adding video to the platform soon, which I'm really excited about, because I think video is such a really personal way to connect. And it's something I've been seeing a lot on TikTok. I see a lot of cancer patients and those who are going through cancer, or those who are terminally ill from cancer, who are in hospice documenting their journey. And it's really eye-opening, and it's getting a lot of people to pay attention. So I do think video is such a big component that I'm really excited that they're adding to the platform. But I love Cancer Go. When they first came to me, and I don't think they know this, but they first approached me on my birthday, and it was my 30th birthday. So I felt like it was a sign, and I felt like I had to be involved in some way, because what they introduced to me, because at first really the focus was a social network, and obviously now it's more than that. But even when I heard of that, I was like, I wish this existed. I really do, because I didn't want to get on Instagram and Facebook when I was sick. I didn't want to see people living their life, because that really is what social media is. It's a place where you post all the happy moments. So it kind of makes us, it's almost like a false sense of reality. Nobody's really posting a lot of the negatives. So to see so many people having fun, going out, doing things, when I was stuck in the hospital, it was really hard. So I told the guys in my, in Kanaki, the founders, when I had first met them, that I was like, if I had your app back then, I probably would have been way less angry, way less depressed. I would have had someone to talk to, because at that time there was no nurse navigator at my hospital. What if there was a nurse navigator on a platform somewhere that I could have just talked to? That would have told me a therapist was the person you go to, not a psychiatrist, because I didn't know the difference. I'm happy it's here now, but I'm really excited to be a part of Cancer Go and to be their spokesperson. And I'm really excited to see where things go from here with them. it's a great app to download. It's available on Google Play and the App Store, so it's ready to go to download if people want to check it out.
So we will put that in the description,
Yes.
so that people can go that as soon as you get it to me.
Yes. I will send you the link to it so that you can.
Okay.
It's a great resource.
That's awesome. There's a question that I have to ask you, and this is totally aside from anything we've talked about, but I think it's something that we all could learn from.
Mhm.
So after college, when exactly did you get married? How did you meet your husband? And how did your cancer journey prepare you for marriage?
Oh, this is such a good question. Because I will say, when I finished chemo, I was terrified of the idea of what it would be like to date again and to get married. Because I'll be really honest, when I was going through chemo, there was a guy I had met in college right before, and he was so kind. I mean, he would send me love letters through Facebook. It was really the sweetest, kindest thing because I was so sick. But of course, once he saw me after treatment was done and I'm bald, it freaked him out. And I didn't blame him. I'm not like judging him. It was a lot. I had no eyebrows. I had no eyelashes. I mean, and I was really puffy from all the steroids I was on. So, that is something that went through my head. Okay, how is it going to be like dating again? What's it going to be like I'm going to have to find a husband who understands what I've gone through, and that, there's a chance one day I could get sick again. I never know what's going to happen. And I want that person to be the person who's not afraid of what, they're seeing, and is going to stick by me when I have no hair. So, and when I'm at my angriest, I guess. So I met my husband a year and a half after I finished chemo when I was in El Paso. So he was just hired as the main anchor for the CBS morning show, and I was already one of the talent for the morning show for Fox. But it was a station owned by the same company, so we worked in the same building, same newsroom. He sat right next to me, and it honestly sometimes feels like fate because we had the same shift. We lived in the same apartment complex. We were really good friends. We just hung out all the. Yeah, it really was like, I was like, wow, you live in that, and then we sat right next to each other, but our jobs had nothing to do with each other. I had my own show, he had his own show. But it was so easy because like we had the same shift. It was so boring after work because we finished work at like noon. So, and we wouldn't go to bed until like 6. So we have like, it almost feels like we have an entire day. So we would all just like hang out, go eat, or watch movies because we're lazy, because we're exhausted from waking up at 2 in the morning. But that was something I told him from the very beginning. Like the first day that we hung out, we talked for like 3 or 4 hours just about our lives growing up and just our health and things like that. Because when he met me, my hair was really short. I had like short hair to my ears. My hair was very much still growing. And he asked me, he was like, he's like, so have you because all my social media pictures, I had long hair. I was very much still like using old pictures and not new pictures. So he was like, so when did you cut your hair? And I was like, well, I had cancer. I was like, my hair is growing back. I basically just threw it out there. I was like, if this person that I'm kind of interested in, really likes me, I kind of want to see how he gauges this topic. And he was just so mature about it, and just so like asking me all these questions about, what treatment was like, how I handled it, and, just how I was feeling then. And, he's had his own health issues, not cancer related. But so we kind of just we had a lot of, similarities, and it was really easy. So my husband and I then ended up getting, well, at that time he was just a friend. We ended up marrying each other 3.5 years later, right before leaving El Paso. So we've been married now for 5 years, but he is my rock. I've had scares since. He has been there for every single one of them. We have cried together because we both have freaked out over scares that we're just like, we're not ready for this. But he's literally held my hand. He's been inside all the doctor's appointments, even as awkward as it would get. Before he was even my husband, he would come with me. And I loved that because I was like, okay, this person hasn't even put a ring on my finger. And he's showing up. He's showing me he cares. To me, this matters more than anything. And I know, like, this is the person. I'm crying, and I don't know why I'm crying, but like, really, just he's an all around amazing person. And to be so involved, he was not affected by cancer, but he is so involved in everything I'm doing with like Be the Difference or Mary Crowley. It's just, and even with Cancer Go, my husband is also involved in a lot of the work that we put in, into the video content we've been helping Cancer Go with, and even spokesperson efforts. My husband is basically a co-spokesperson with me. So to have him be an advocate as somebody who has not experienced cancer himself or even his parents, it's it means the world to me. So I got lucky.
That is that is a great story. I love that.
Thank
I
you.
absolutely love that. And thank you for sharing so openly.
Yeah.
I think you realize by now that I'll throw anything out there.
Yeah.
And
I'm ready to answer him.
so thank you for your candidness and thank you for your honesty, because that's how we all learn, is through experience of others,
Exactly.
and understanding this journey is not easy at all. And
It's not.
but there's so many incredible benefits because of the journey itself, which,
Exactly.
I think we learn that after we go through it and reflect back about that.
Mhm.
Wouldn't you agree?
Oh, absolutely. Oh, I completely agree. Especially looking back, it's like I look at everything that's even just transpired since and just where everything's headed. It's just, everything happened was meant to happen. And everything, I think, I feel like those of us who maybe who have gotten this disease, unfortunately, were given it for a reason. We were supposed to be the ones to, I think, advocate for others and to help spread a message to help prevent this, because I do think there's a lot of ways that we could do to help prevent. And it really is, right at this moment, it's early detection. So it's more knowledge I think people have is where I'm always like so focused on.
Knowledge is just so important, especially in cancer.
Oh
And,
yeah.
and for those people who do get cancer, uh, as we, advocate, get educated on
Yes.
everything that you can. Get educated on the medications that you're being
Absolutely.
prescribed. Get educated on the chemotherapy, the type of chemotherapy
Mhm.
that you're being given, and so that you understand. So it's not just a, okay, doc, it's okay for
Yes.
you to do whatever you're going to do, and I have no
Mhm.
idea, because
Yes.
that creates fear.
Yes. I
Create
agree.
Yeah, because that creates fear, because we don't know what's going on. But if we educate ourselves about what is going on, then we're going to be so much more in the light and we'll be able to understand things so much better.
I agree. And it makes communication with your provider so much easier because I have met, just like you're saying, I really have met a, way too many people, I think, who don't know what like drugs they were getting from chemo. And I'm like, you should know this. It may be scary. And it's a scary idea to like go look it up. But honestly, I'm happy I looked into every little minute detail. It made it less scary. So I asked all the right questions. I made sure I was not ready for another mistake to happen. So doctors make mistakes. It's inevitable. We're human. Everyone's human. Mistakes will happen. So you have to advocate for yourself as a patient, and you should know every detail, like you're saying, of your chemo. It's so important. You're putting the stuff in your body. You should know about it.
Right, right. And I mean, we anybody who's gone through chemo, you know, we all know, everybody's heard the horror stories about, you know, how bad it is, and chemo brain, and all of these things about it. But what makes it worse is if you don't understand, why it's happening, or the things that we go through. And if we educate yourself, as much as you possibly can, you know, you're going to be so much better off as you go forward because,
Mhm.
you know, when somebody gets cancer, uh, it is so complex and
Mhm.
there's so many things involved. Um, but one of the most important things is to be true to yourself and to learn about what the journey is all about. Because I talk to cancer people all the time, cancer patients all the time, and the most common response is, "Oh, you know, whatever my oncologist tells me, or whatever my doctor tells me, that's what I do." I said, do you know and understand what they're having you do?" "Oh, no, they do."
I know
Yeah,
it's like you gotta know
yeah,
what you're getting into.
absolutely, absolutely, and it's so so important. So thank you for the incredible knowledge that you've shared with us, Kajal. Uh, and so, what I'd like to ask you this at this point is, what would you like to leave everyone, our audience, with as far as a final thought?
Oh, my big thing is early detection and knowledge. The more you know, the better. You know your body better than anyone out there. If just something feels off, go to a doctor, ask for a checkup, ask for a scan if you can get one. Sometimes they'll do it. If you feel like the symptoms are bad enough and they do, they will get you a scan. If they don't, get a second opinion. It really makes all the difference. The later you find out, or, you know, the more you wait, you're potentially, you know, gonna have a higher stage of cancer if, let's say, you get diagnosed with cancer. So I'm always in the band of early detection because until we have a cure, early detection is what will save our lives. I mean, one of the best examples right now I could give is the entertainment host Maria Menounos. She was just diagnosed with pancreatic. My grandmother died again within 4 months of having pancreatic cancer. Maria Menounos is here today because of early detection. She caught it so early that she was able to get treated. I mean, it's incredible with a cancer like that. So it proves that the sooner you go and get something checked, detected, that better your outcomes are. So I hope this pressures everyone to make that appointment and get that physical and get that checkup if you need to as well. So that's the advice I would give.
That is great advice. Absolutely great advice. Kezhal Dashti, thank you so much for joining us again for this part three of our three-part interview, and for sharing, you know, so many personal things about it, about your cancer journey and other things, and the knowledge, and keep up the, you know, you're advocating for cancer patients and helping. And thank you so much for all of your efforts. I really really appreciate that, and love it, because we're all on the same team.
I couldn't agree.
And if we get on the same side and pull on the same end of the rope, that's how
I
things go.
agree. It's a team effort.
Right, absolutely. So thank you so much, Kajal. And
Sure.
at this time, I'd like to share a couple of quotes from Dr. Norman Vincent Peale. And the first one, I love this one. Never think of failing. You don't need to. And the second one is a clean mind always delivers power. And so thank you so much for joining us here at To Be Your Own Hero. Please subscribe, like, make a comment in the comment section, because we do respond to the comments. And in fact, I passed one of the comments on to Kajal,
You were really sweet. Thank you guys.
that somebody wrote. And so, yeah, I mean, that's what it's all about. Let's help make this world a better place. And the only way we can help make it a better place is if everybody steps up and gives some effort, even if it's just to smile at somebody, or help, you know, an older person walk across the street, or you
Mhm.
know, smile at somebody at the bank, or whatever it may be. Make it a habit, make it a conscious effort. And if we all do that, guess what? Slowly, the world is going to get better, because our world is in a lot of hurt. And the only way it's going to get better is if we help make it get better,
I
and by
agree.
giving the effort. So at this time, I'd like to say this: let's help make this world a better place by giving the effort, making the most out of every single day, every single hour, every single minute, and every single breath. Thank you so much for joining us here at To Be Your Own Hero. We will see you next week, and have a great, blessed week, everyone. Thank you.